Don't drink plain water if you have kidney disease, do this instead. With stage 3 kidney disease, your body can react strangely to plain water. Sometimes you feel worse, not better. Today, I'm going to talk about a safer way to hydrate that helps control swelling, supports minerals, and protects your kidneys. After that, you will learn 3 simple supporting foods and habits that help keep your kidneys stable. Do not miss the 3rd tip because it is something most patients never try. And of course, there is a bonus tip at the end for extra support. Let's begin with something many people overlook, even though it can change how your body handles fluid. It helps weak kidneys manage water without stress and keeps your hydration balanced throughout the day. We are starting with the smart hydration method known as electrolyte balanced hydration broth. Weak kidneys often struggle with basic fluid control, and this creates daily stress. Mineral imbalance grows when the kidneys cannot move sodium and potassium at a steady speed. Urine output also drops, and this slows the release of extra fluid from the body. Many patients with stage 3 kidney disease feel swelling, heaviness, and tiredness for this reason. When someone with weak kidneys drinks plain water fast, the water can wash out sodium very quickly. This sudden drop in sodium forces the kidneys to work harder, even when they already struggle. The body then tries to pull sodium from cells to fix this imbalance. This can lead to headaches, dizziness, and fluid moving into the legs or face. Plain water also increases free water inside the body, and this can create free water overload. Research from Cleveland Clinic shows how free water overload can weaken kidney control of minerals. The National Kidney Foundation also notes that weak kidneys often cannot manage plain water flow well. This can raise blood pressure swings and nighttime urination. Many people do not know that nighttime urination often rises when sodium moves out too fast. This pulls more fluid into the kidneys at night. Have you noticed your sleep getting worse because you wake up to urinate more often? A better approach is controlled hydration that keeps minerals steady and moves fluid slowly. A hydration broth with balanced electrolytes supports a more gentle flow of water into the cells. This helps the kidneys manage each mineral shift with less effort and less pressure. It also reduces edema because the fluid does not rush into the tissues. Blood pressure also stays more stable because the sodium levels do not jump or fall. Energy feels more steady because the body works with balanced minerals, not sudden drops. This also lowers the risk of hyponatremia because sodium stays in a safer range. A low-sodium vegetable broth base is used because it has only 40 to 60 milligrams of sodium. This amount prevents fluid retention but still supports basic mineral function. Peeled zucchini and yellow squash add small amounts of potassium, around 30 to 60 milligrams in half a cup cooked. This helps fill small mineral gaps without raising potassium too high. Celery seeds or parsley add tiny traces of minerals that are safe for the kidneys. A small amount of lemon juice adds only a little potassium and can help absorption of minerals. A pinch of magnesium glycinate powder can help relax the tissues, but only if a doctor agrees. This is important because magnesium can interact with some medicines. The broth works best when used slowly through the day. Half to 1 cup at a time works well for most people. Many kidney doctors tell patients to replace half of their daily drinks with structured hydration. This means drinking the broth 2 or 3 times a day. Morning and early afternoon are best because the kidneys process fluid better earlier in the day. A gap before evening helps prevent nighttime urination. One simple broth uses 1 cup of low-sodium vegetable broth with 2 slices of peeled zucchini and 1 tablespoon of parsley. It simmers for 10 minutes and is then strained for easy drinking. It can be warm or room temperature. Another option is a herbal infusion with 1 cup of water and 1 tablespoon of dried chamomile. It steeps for 5 minutes with a small splash of lemon. Chamomile has a calming effect on the tissues and may ease mild inflammation. When buying broth, choose labels with less than 150 milligrams of sodium per cup. High sodium broths can stress the kidneys and raise fluid retention. Bone broth should be avoided because it contains high phosphorus, and this is difficult for weak kidneys. Herbal teas should be simple dried herbs without potassium chloride additives. Many flavored water enhancers contain artificial dyes and added potassium, and these can harm kidney balance. Some mistakes can reduce the benefit of this method. Drinking broth too fast can cause bloating because fluid moves faster than the kidneys can adjust. Sports drinks are unsafe because they contain very high sodium and potassium. Bouillon cubes also carry high phosphorus and sodium, which can strain kidneys. Magnesium powder can clash with some diuretics, and herbal teas can interact with pressure medicine. Each new drink should be checked with a doctor if someone takes daily medicine. Now that you understand this hydration method, we can move toward a food that also helps filtration. This next choice is light and easy on the kidneys and supports steady fluid balance. We will now look at the benefits of watermelon radish. Before we continue, tell me where you are watching from and how long you have been dealing with kidney disease at stage 3 or above. If you want help to manage kidney strain and support safer hydration, please subscribe to Kidnease and turn on the bell. And if this helps you, type 1 in the comments or 0 if it does not. Many people with stage 3 kidney disease need foods that support low strain on the kidneys. Watermelon radish can help because it gives minerals in a safe range and supports steady blood flow. It holds about 280 milligrams of potassium in 1 cup sliced. And this is moderate for kidney health when the portion stays small. The body uses potassium for nerve function and muscle balance, but too much can slow the heart. A small portion avoids that risk and still supports normal cell function. This vegetable also brings 20 to 25 milligrams of vitamin C in 1 cup. Vitamin C supports collagen, and this helps the blood vessels stay strong when kidney health is weak. Strong vessels help pressure control because the walls stay flexible and can move with each pulse. The natural nitrates in this radish support microcirculation in many small blood vessels. Better microcirculation means more oxygen moves into tissue with less pressure change. These nitrates do not raise blood pressure because they act in a slow and steady way. They help relax vessel walls without sudden dilation. A steady flow helps kidney tissue stay supplied with better blood movement. Watermelon radish also holds compounds that act like sulforaphane. These help lower oxidative stress on nephrons. Nephrons need protection because they filter waste every minute and work harder when kidney function drops. Oxidative stress can damage the nephron walls and raise inflammation. A safe daily amount is 1/4 to 1/2 cup. This keeps potassium safe and gives enough nutrients for daily support. Midday works best because digestion is active and the body does not push fluid at night. Late evening servings can raise nighttime urination because fiber and water inside the radish move fluid forward in the gut. Simple food ideas can make this vegetable easy to use. A calm radish slaw uses thin slices and gentle herbs to support digestion. It gives crunch without heavy salt or vinegar. A light herb mix can give flavor with no irritation for the kidneys. A soft pickle-style version without vinegar can give a fresh taste. Vinegar is avoided because it can irritate the bladder and raise acid load. When buying watermelon radish, find pieces that feel heavy for their size. The skin should look bright with no soft marks. A heavy piece shows more water inside, and this means better freshness. Do not choose pre-cut versions stored in acid because the acid can change the mineral balance. Whole radishes can stay fresh in the refrigerator for 10 days if they stay dry and wrapped. This helps save cost because the vegetable stays good for many days. There are a few risks with this food. Too much can cause gas because the fiber ferments in the gut. Gas can press on the abdomen and raise pressure on the kidneys. People who take thyroid medicine should avoid high intake because this radish has mild goitrogen content. Goitrogens can affect thyroid balance when the thyroid is already low. If this is helping you understand safer steps for stage 3 kidney disease or above, please like this video. A simple like helps YouTube show Kidnease to more people who need support. If you think others with kidney disease should learn this too, tap that like button now. Now we turn our attention to a food that is soft, mild, and helpful for lower phosphorus needs. This next choice has a gentle protein source and supports kidney needs with less strain. The next food is ricotta made from whey protein isolate. Low phosphorus whey, ricotta gives gentle support for people with stage 3 or stage 4 kidney disease. It gives 7 to 10 grams of protein in 1/2 cup. This amount helps repair tissue without pushing the kidneys to filter excess protein waste. It holds around 40 to 60 milligrams of phosphorus, which is far lower than regular dairy. Low phosphorus reduces strain because damaged kidneys remove phosphorus very slowly. This helps protect the heart and bones because high phosphorus forces the body to pull calcium from bones. The calcium inside this ricotta is around 80 to 100 milligrams, which supports bone strength without raising phosphorus load. It also holds essential amino acids that help maintain muscle when appetite becomes low. Weak kidneys can cause loss of muscle because toxins build up and lower hunger. The body absorbs whey protein better than whole dairy. This means the kidneys face less leftover waste from digestion. Harvard School of Public Health shows whey isolates have low phosphorus absorption, which is helpful for people with reduced kidney function. Better absorption also means you get more benefit from a small amount of food. This helps because kidney diets often limit many foods, and variety becomes important. Have you ever felt unsure about which protein is safe for you? Whey ricotta can give steady protein without raising potassium or phosphorus. The best time to eat this food is in the morning or at noon because the kidneys work better earlier in the day. A safe amount is 1/4 to 1/2 cup per day. This keeps protein moderate and avoids stress on the nephrons. You can mix it with cinnamon to add flavor without adding sodium. You can also add 5 to 7 blueberries, which is a safe amount for potassium control. These berries give antioxidants that help manage cell stress. You can also spread the ricotta on a low-sodium cracker for a simple snack. This avoids salt spikes, which can harm kidney pressure. A small recipe can help you use it daily. A cinnamon ricotta cup uses a small scoop with a bit of cinnamon. This gives a mild sweet taste without sugar or salt. A savory version uses a small amount of gentle herbs that do not raise sodium. These herbs add flavor and help digestion because they stimulate mild digestive flow. When buying this ricotta, choose whey isolate forms, which have very low phosphorus. A homemade version can use whey isolate powder with a few drops of lemon. This gives a soft texture and very low potassium. You should avoid shelf-stable ricotta because these products often contain phosphate additives. Additives enter the blood fast and force the kidneys to work harder. Fresh forms avoid this problem. There are safety notes that matter for people with kidney disease. People with lactose intolerance should avoid this food because it can cause gas and cramps. Gas can push on the abdomen and raise pressure on the kidneys. People with a glomerular filtration rate below 30 should track protein because too much protein can build waste. This can raise urea levels and lower energy. Now we shift our focus to something gentle and calming that supports the urinary system. The next item may help reduce albumin leakage and support kidney comfort. It is time to look at corn silk tea. Corn silk tea can support people with stage 3 kidney disease because it holds natural compounds that calm irritation in the urinary tract. It contains mason, which helps lower swelling in the small tubes that carry urine. It also contains allantoin that supports repair of tender tissue inside the urinary system. These tissues often face stress because waste removal slows when kidney function drops. The flavonoids inside corn silk help reduce oxidative pressure, which protects the lining from slow damage. Oxidative pressure often rises when toxins stay longer in the blood. Corn silk tea has a mild diuretic effect that moves fluid gently. This action is softer than plain water, which can force the kidneys to move too much fluid at once. Weak kidneys cannot handle fast water movement, and this can create overload. A gentle flow helps the body release extra fluid without sudden pressure changes. Studies from the University of Minnesota show that corn silk can soothe the lining of the urinary tract. This matters because irritation in the tract can increase burning and urgency, and also raise inflammation that strains the kidneys. A safe amount is 1/2 cup to 1 cup per day. Early afternoon is the best time because the kidneys work more steadily during the day. Evening use can disturb sleep because even mild diuretic action can increase nighttime trips to the bathroom. People who use diuretics should avoid taking this tea at the same time because the combined effect can lower potassium too much. Potassium is important for heart function, so balance is very important. Corn silk tea is simple to prepare. Fresh or dried corn silk can simmer for 10 minutes in water. The slow simmer pulls the soothing compounds into the tea. A small mint leaf can add flavor and also support digestion. Mint is safe for kidney health because it does not raise potassium. Lemon should be avoided because it adds potassium and acid, which can irritate the bladder. A soft warm temperature helps relax the smooth muscle in the urinary tract. When buying corn silk tea, it is better to choose organic dried corn silk. Organic options avoid heavy chemical sprays that can burden weak kidneys. It is better to avoid blends that include hibiscus because hibiscus can be too acidic. Acidic drinks can irritate the bladder and may raise discomfort during urination. Dandelion blends should also be avoided because dandelion has strong diuretic action. Strong diuretics cause fast fluid movement, which can stress damaged kidneys. There are a few risks to know. Corn silk tea can lower potassium a little. This is helpful for some people, but it can be unsafe if potassium is already low. It can also increase the strength of blood pressure medications. This happens because the tea can lower fluid volume and change how the body absorbs medicine. Do you believe herbal approaches like corn silk tea can really support kidney health? Or do you think they are overhyped? Comment below with your honest viewpoint. Now we move toward a simple body method that helps control swelling and fluid shifts. Many doctors say this method supports kidney comfort because it moves fluid before bedtime. We will now talk about daily lymphatic ankle pumping. Daily lymphatic ankle pumping can help people with stage 3 kidney disease because it moves fluid that sits in the lower legs. Weak kidneys often allow fluid to gather in the feet and ankles since the body cannot clear water at a steady speed. When fluid stays in the legs all day, it can shift upward at night. This shift sends sudden water pressure toward the kidneys and bladder. This can raise nighttime urination and can disturb sleep. Gentle ankle pumping helps the lymph system pull fluid back into circulation early in the day. The lymph system has no pump, so body movement pushes fluid forward, and this is why small movements matter. Regular pumping can lower swelling, which also helps blood pressure stay more stable. High swelling can squeeze blood vessels and raise pressure, which harms kidney tissue. Many large hospitals teach this method in physical therapy programs because it protects joints and improves fluid movement. It also helps the calf muscles work better, which supports the venous system. Slow walking can help too, but many people with swelling cannot walk far. Ankle pumping gives a simple way to move fluid with very low strain. The method is easy to do. Sit in a chair with your legs straight and lift your feet a little. Point your toes away from you, then pull them back toward you in a slow rhythm. This motion is called flexion and extension and helps move fluid through the foot and calf. 5 to 10 minutes is enough for one session. 2 to 3 sessions during the day work well because they prevent fluid from sitting too long. Light calf massage after the pumping can help because it pushes lymph toward larger vessels. Massage also warms the tissue, which may support better flow. A few people should avoid this method. People with severe nerve loss in the feet should only do it with help because they may not sense pain or pressure. People with a blood clot must wait for a doctor to approve movement because pumping can move the clot. Do you ever feel tightness in your lower legs when you stand up after resting? That can mean fluid buildup that needs gentle movement. There are mistakes that lower the benefit. Some people only do the pumping at night. It is more helpful earlier because it removes fluid before it moves upward. Eating high-salt meals near a session also slows progress because salt pulls water into the tissue. Salt overload can reverse the progress and raise swelling again. Now we shift our focus to a gentle food that supports people with stage 3 kidney disease in a safe way. Many kidney patients search for a vegetable that gives steady nutrients without pushing potassium too high. This next choice has mild taste and helps the kidneys work with less strain. I am talking about cauliflower. Cauliflower can help because it offers strong nutrition with low mineral load. It carries around 300 milligrams of potassium in 1 full cup cooked. This level is moderate and safe when portions stay small. A smaller serving like 1/2 cup gives far less potassium and still provides good fiber and vitamins. This helps people who need safe vegetables that will not raise potassium suddenly. Cauliflower also holds vitamin C that supports immune health and blood vessel strength. Strong vessels help the kidneys because stable flow reduces pressure on the nephrons. The fiber inside cauliflower supports the gut, which helps kidney health because the gut removes some toxins. When the kidneys cannot remove toxins fast enough, the gut becomes more important. Gut fiber also lowers inflammation because it feeds helpful bacteria that calm the body. Inflammation harms the kidneys because it damages delicate filters in each nephron. Cauliflower contains natural compounds called glucosinolates that break into helpful molecules. These molecules help lower oxidative stress that increases with kidney disease. Studies from the National Institutes of Health show that cruciferous vegetables can support cell repair through these compounds. A safe serving for most people is 1/2 cup per day. This serving supports cell health without raising potassium too quickly. Midday or early evening works well because digestion is active at that time. Late-night servings can raise gas pressure, which can disturb sleep. Gas buildup can press on the abdomen and raise pressure on the kidneys. Preparation helps lower strain. Steamed cauliflower works best because it softens the fibers and lowers digestive stress. You can mash it with a little olive oil for a smooth texture. This creates a mild side dish that feels light and easy to digest. You can also roast small pieces with light herbs. This adds flavor without adding sodium. Cauliflower rice is another easy method that replaces high carbohydrate sides. It gives fullness without heavy mineral load. When buying cauliflower, choose firm, heavy heads with tight white florets. Soft spots show decay and can raise bacteria. Do not choose pre-cut bags that look wet because moisture can grow bacteria fast. Store it in the refrigerator for up to 1 week to keep nutrients safe. There are a few risks. Too much cauliflower can cause gas, which can raise abdominal pressure. People taking thyroid medicine should keep portions steady because cruciferous vegetables can affect thyroid balance in very high amounts. Now we bring all these parts together so you can act on them with confidence. Use electrolyte-balanced hydration broth to support safe fluid movement and avoid overload. Add a small serving of watermelon radish for gentle support and safe minerals. Choose low-phosphorus whey ricotta to protect the kidneys while giving steady protein. Drink corn silk tea for soft urinary support and calm tissue. Use daily lymphatic ankle pumping to move fluid from the legs and ease kidney strain. Add a half cup of cauliflower for safe fiber and strong cell support. If this video helped you understand kidney disease stage 3 or above, do not leave without subscribing to Kidnease. This channel shares only topics for people living with stage 3 kidney disease or above. And if you feel this content gave you real support, type the word relief in the comments.